when we were talking about the chest wall cavity, where we need to expand it to have the lungs give it the space so that they can breathe in properly. Now, for today's session, we'll be focusing on the accessory muscles of the lungs and the chest wall cavity. Before we get to start in with for the session of today, we need to have a good and a very brief, just a recap for all the exercises that we did yesterday. To start with, we did deep breathing exercises in the starting, where we were breathing in through our nose, breathing out through our mouth. To start with, we'll start with the last exercise, where we need to expand the thorax, where we're lifting our hands up and then breathing in. So you need to lift your hands up, we breathe in, and when you bring your hands down, you breathe out. Again, you breathe in, and once you hold it there, then you breathe out. There was the second exercise in this only, when we were bringing our hands out. And then when we are relaxing, we were taking it all down. Again, breathe in and relax to breathe out. Right? Next, what we did was, we did the segmental exercises, where we started with keeping our hands on the particular segment of the lung. So you started with the shoulder. You'll be keeping your hands here. While you keep your hands here, you need to breathe in, focus and meditate on all the parts of the lung that are beneath your hands. And while you're inhaling deep breathe, you need to focus on your hands, that they are getting lifted up. When they're getting lifted up, the air is actually getting filled inside the lung of that segment. So you breathe in, lift up, and you breathe out. Again, you inhale in, your hands lift up, and you breathe out. Next was your middle part of the lung. When you were doing this exercise, all you need to keep your hands on the side of your chest wall, and you breathe in. You should feel that your hands are being pushed outwards through your lungs, and you breathe out, you relax, they should come back. Again, you breathe in, your hands lift out. Once you breathe out, they should relax. Lastly, we did for the lower lobe, the last segment. We'll be keeping our hands on the side of the chest wall, just above your stomach, and you need to breathe in. You move your hands out, and then you relax. Your hands move in. Again, you breathe in, your hands move out, you relax, and they come back. These were the set of exercises that we did yesterday. Now, for today's session, we'll be focusing on the accessory muscles of our lungs, of our chest wall. Those are the basic neck muscles. If you start with them, there are slightly bit confusing, because all the exercises have some or the other relation with each other. So pay very good attention to the exercises today, because the angle for which we will be doing the exercises will change the muscle also. To start with, we'll start with the basic one, where you just need to tilt your head towards one side of your shoulder. When you're doing that, just make sure that you're trying to touch your ear to your shoulder. It won't actually touch it, but just need to give it a signal that this needs to go down onto your shoulder for the same side. So you need to move like this. Once you're doing this, you're trying to touch your ear to your shoulder. the muscle of this side will be getting stretched. You should feel it that the muscle is getting stretched throughout. Once you feel that stretch, you start getting that stretch feeling. Hold it for about 20 seconds and then relax back. Again, keeping your back straight, keeping your posture straight. You just need to look forward, and looking forward, you need to bend your neck towards one side like you're trying to touch your ear to the shoulder, and let the muscle on the other side get stretched. Once you feel the stretch, hold it for about 20 seconds. Once it's done, slowly come back to the normal position. Again, we'll be repeating on the same side. You need to bend it and try to stretch. Hold the stretch for about 20 seconds. Once it's done, you return back to normal. One more and the last repetition. You need to take it to this side, hold it, and coming back to normal. This was done for this side. Now to repeat for the other side. All you need to do it again. Bend your neck. Take the earlobe to your shoulder. Once it's done, the stretch should be coming onto this side. And you need to hold it. Then relax. Coming back to neutral. The best way to do this exercise is to keep something in front of you to have a focus so that your neck stays in neutral position. Once that is there, even if you're trying to touch your earlobe, your neck won't rotate. The basic thing that we need to understand in this exercise is the neck doesn't have to rotate in any way. The only thing that needs to do is tilt on the side. So again, you do it, you tilt it. Once you tilt, you start feeling the stretch coming onto this side. The moment you start feeling the stretch, hold it and then relax. 20 seconds is a maximum stretch that you need to give it, and 5 repetitions in one go. Then you need to relax. Again, you move it, let the stretch come in, and you relax. Again, and you come back to normal. This was the first exercise. Next, we'll be focusing on the other muscle. For that, what you need to do is you need to look down, just down, and then look into your pocket and then give it a stretch. Stretch in the sense you can hold your head and try to look into your pocket more. In case you feel that you're not getting the stretch comfortably or you might not feel the stretch is coming there, what you can do is with your same hand of the side that you're exercising, try to hold the chair that you're sitting on, keep a firm hold over it, and then bend, look into your pocket, keep your hand over the head, and just stretch. While doing this exercise, the shoulder has to be maintained in this neutral position. What happens usually is when you're trying to look into your pocket, the shoulder has the tendency to lift itself up. We need to relax this shoulder. So the best way is to hold something down here and then just look into your pocket and give it a gentle stretch. While doing this, you'll feel the stretch going back on your neck towards your shoulder. Again, Need to keep this hand stable, look down into your pocket and just give it a stretch. Now, same has to be repeated on the other side. Again, you'll be keeping this hand stable so the shoulder doesn't lift up. Once it's done, look down into the pocket area and giving it a gentle stretch. In case you feel that while looking into the pocket area, the stretch is not that much good, even when you're taking care of your shoulder, you can also look into your armpits. If that stretch is not actually not being that much helpful. So you can look into your armpit also and then give it a stretch. So you look into your armpit and then give it a stretch. These are the two basic modifications for it. The muscle that is being stretched will remain the same. There are just two different ways of doing it, either into the pocket or into the armpit. Not much of a distance to look into. But sometimes what happens is the muscles are not that much taut or they are not that much tight. So they might not give you that much of relaxation while you're doing it. So you get that stretch to actually feel the muscle being stretched over, you need to have that angle. So you can slightly shift it up and then give it a pull. Okay. Now, for the next exercise, these two were for this muscle first. Secondly, going on the back. Now, we'll be coming over the front one. For this, what you need to do is you need to try to look up. When you're trying to look up, you just need to give it a stretch on the opposite side. So you're looking forward, you move your head towards one side and then just tilt your head back. Now, while you're tilting your head back, usually what happens is your jaw muscle gets pulled down. So you try to open your mouth. You don't have to open your mouth. The mouth should be kept closed. So you need to move your head towards one side of the shoulder and then you need to look slightly up. While you're doing that, keeping your mouth closed, let this muscle get stretched. While you're doing this exercise, the stretch will be coming onto this side. Make sure that you're keeping your mouth closed. The jaw has to be in that position so that the muscle gets stretched. In case you feel that going sideways and moving up is not being fruitful, you can tilt your head back, but with movement. So you need to look towards one side and then tilt your head back. Once you do that, you'll definitely get the stretch onto this side. Now, last two more for this side, then we'll repeat on that other side. You look onto one side of the neck and then you tilt your head back, keeping your mouth closed. Let the stretch come over and relax. One more. You look onto one side, you tilt your head back and hold. Again, while you're doing these exercises, for all the exercises of stretching of any of the muscle throughout your body, if you're doing any stretching exercise, The basic rule is to give the stretch for about 20 to 30 seconds in one go and about 5 to 6 repetitions. That's it. Not more than 5 to 6 repetitions and not more than 20 to 30 seconds of hold in one go. After 20 to 30 seconds, whatever you are comfortable with, you need to give a break. Maybe the break might last for about 5 to 7 seconds, or it might last for 1 minute also. That can be adjustable. But the stretch has to be given for about 20 to 30 seconds. That's it. Now, we'll be doing it for the other side. Again, you need to just move towards one side, look onto one side, tilt your head back up, keeping your mouth closed. The muscle needs to get stretched. Again, coming back to neutral, you go about this again, look onto one side, tilt your head back up, keeping your mouth closed. Let the muscle get stretched. In case the muscles around your body, around your neck are way too tight, that even when you're doing this movement, the muscle is getting stretched, you don't need to overdo this by lifting it up. The main purpose of doing these exercises is to let the muscles around the lung and the neck portion be stretched. Whenever the stretch starts feeling, stop it, hold that position so the muscle gets that much elasticity to get stretched. Once the stretching improves, you'll yourself feel that you can now lift up and look up. Once you feel that, you can go ahead with that. In case you don't feel that, stop at that position and try to make that stretch fruitful. Again, you lift, look it to one side, tilt up, and let the stretch come in. Coming back down. Again, while doing these exercises, if you feel that your shoulders are being lifted way too much, you're not able to relax them, this is the best way you can stop them. All you need to do is have a chair that has a support over beneath. Every chair has. You just need to grab that and let your shoulders relax onto it. You can have a good grip or you can have a loose grip. That's up to you. But keeping your shoulders relaxed and down will help get the stretch better. Now, lastly, we have done it for the back, we have done for the side, we have done it for the front. Now, there is one stretch that is left for your spine. So the middle part of your neck from the back. All you need to do is you need to keep your shoulders relaxed and just look down the maximum you can. While you are doing this, you'll feel the stretch going down onto your spine, not just your upper thorax, not just till your thorax level, but also till your lumbar. So it might reach up to your lower back also. So let the stretch come in, keeping your shoulders relaxed, keeping your neck straight, looking forward again to a simple object that you might have kept in front of you. Keeping a focus on that, you just need to look down. Once you're done with that, you can relax. Again, you relax. Lastly, one more. relax. While doing this exercise, if you feel that you might have some dizziness, you feel that you're getting slightly dizzy, एक faint होने जैसी feeling आने लगी है, or you feel that थोड़ा सा चक्कर आ रहा है, stop it. It's not required for that. In case you are not feeling anything out of it, you can continue with that. It might happen that you might be feeling good with this exercise today, and tomorrow again, when you try to do it, you might feel that there is something going on. Stop it then and there. There is no need to overlook about that. Next, we'll be doing the chest chin tuck-ins. So what we need to do is just need to keep something in focus and try to tuck your chin in. There are two different things that you can do in this exercise that are wrong. That is actually tilting your head down or tilting your head back. You don't have to do anything like that. You're trying to do is you're trying to hit your head back onto something when you're not able to move your body. So you just need to try and tuck your chin in, your head back. That's it. And then come forward. Once you come forward, your chin will be out. Again, you need to chin in and hold that. While you're doing this, you'll also feel that your thorax and your upper back is being exercised because they are putting in pressure to maintain that posture. That also helps to reduce the hump that you usually get on the cervical neck. All you need to do is you need to chin down and relax. One more time. All you need to do is push your head back and hold and relax. Now, last exercise for today, that is active breathing. This is a cycle of breathing. You have three basic exercises in it. First, you need to maintain the rhythm of it. The rhythm was set with the first day exercise. If you remember the deep breathing exercise that we did on the first day, that will set the rhythm for this exercise. So you need to start with that. You'll be breathing in and breathing out with the rhythm. 3, 4, 3. So you breathe in, 1, 2, 3. You hold that breath for another 4 seconds and you breathe out with 3 seconds more. Again, you start with this, you breathe in, you hold that breath, and you breathe out. Again, you breathe in, holding that breath, and you breathe out. This way, the rhythm will be set for this exercise. You have to repeat this exercise for about 5 repetitions. Once you're done with the rhythm, you'll be focusing on the next exercise, that is the diaphragmatic exercise. Remember, we did was the belly exercise, lifting the belly out. You have to repeat that. So you'll be doing the first exercise with the deep breathing. Then you continue with the diaphragmatic again for 5 repetitions. And then lastly with the third. So we'll do the diaphragmatic now. Remember the diaphragmatic? You need to bring your belly out. All you need to do is you need to breathe in, bringing your belly out, filling the air in the belly, holding it, and then breathing out. Again. Again. Lastly, when you're doing the last exercise with this, in that exercise, I would want you to practice some forced expiration. Forced expiration is like you're trying to fog a mirror. Have you ever done that? Might have done that during your earlier ages also, and sometimes now also. In case you want to, fog a mirror, you just blow out air onto it. That's the same exercise that we're going to do now. All you need to do is sit in a comfortable position, breathe in a very medium breath. So don't need to breathe in throughout your lungs. Just a normal breathe like you're trying to breathe normally. So you take in breathe, hold it. Now, when you need to breathe out, you need to give it a forced expiration. So you breathe in like this, a forced expiration. It might take you around 1 or 2 seconds to actually get that breathe out. That's it. You just need to bring it in a forced position. While you're doing this exercise, this will help actually the mucus to move up onto your respiratory tract. So whatever the lungs have been getting stored into it, whatever foreign bodies are getting stored into the lung, during these exercises, the breakdown of these exercises, you're trying to move that foreign body and bring that into your tracheal pipe. Now, once that is in your tracheal pipe, that once that is inside the lungs, it's easier to bring it out. Now, to bring it out, you just need to force it through your lungs. So the lungs need to give it a negative pressure that blows it up onto your tracheal pipe. Once it's here, we can cough it out. So we'll try with this again. All you need to do is breathe in a normal breath and then blow it out. Now, while you're blowing it out, your mouth should be open. So again, like you're trying to fog the mirror, it's the same thing. So you breathe in. For one instance also, what you can do is, in case you feel that sudden expiration is not that much feasible, it's not that much comfortable, you can keep your hands over to your chest. And while you're breathing out, just push, just give a little push through your hands onto your chest like this. Okay, all you need to do is keep your hands over your chest level, breathe in, and then so you're pushing it in, and the lungs expand, relax. They send the air out. Again, just a little pressure. बहुत ज्यादा pressure नहीं देना है, बहुत ज्यादा धक्का नहीं मारना है. बहुत आराम से, while you're just pushing it, a sudden push through your hands so that the lungs feel the negative pressure and the mucus is being sent out. These are the exercises that are being included into active cycle breathing technique. Active cycle of breathing technique involves these three basic exercises. You start with the rhythm, you enhance the lung and the belly to get expand. Once that is there, you focus on the force expiration. The force expiration is basically helpful with the mucus so that it is being thrown out. Once the mucus is being felt in your tracheal pipe or your throat, you can just cough it out and the mucus will be out. Okay. Also, remember that we did some of the tips and tricks for asthma and COPD while we were trying to do some fun activities along with that. I also got to know that we can also use some wind instruments or singing for it. I hope everyone of you would be loving singing as well. So this is the best exercise you can do for your breathing also. The songs that are very rhythmic, that are very slow, that enhance your breathing pattern. Start with the basic ones, start with slow tones, the lower notes, and you can advance to them. It's not always necessary that you should be, someone from Indian Idol to have that good note of it. You can also do it in the bathroom itself whenever you feel comfortable with it. Again, we'll be ending today's session, and I hope to see you all tomorrow again. The quiz will be live again in few minutes. I hope to see you all answering the quiz and winning the hampers. Take care, everyone. Namaste.